Welcome to the next episode of Mind Your Migraine. I am Dr. Deep Kayed, and with me today is Dina. Dina, thank you for being with us today. Dina, can you please tell me about the first time you experienced a migraine attack and what did it feel like?
That was a long time ago. My first migraine hit me when I was 18 years old. It was right after my 18th birthday. It was a strong headache, the type of headache that would make you drop everything you're doing and just want to lie down in bed. I grabbed some over-the-counter medication. It didn't work for me, and I just spent my entire day lying in bed waiting for that headache to subside. Of course, after a long night's sleep, that went away, and I continued the next day and my activities normally. So that was like the first migraine I had.
So you must have suffered many migraine headaches during your university years. How did you cope with that?
It was hard at that time. I didn't think of going and visiting a doctor or seeing a neurologist. I thought that this is part of the adult life. Well, I'm growing up. I'm in university now. Adults get headaches. So it was a struggle. It was difficult to sit in lectures, writing down your notes, taking your exams, having those strong headaches. I actually went and saw a neurologist years after college. So it was a difficult time for me, but I had to cope with it. I had to live with it. There was no other option.
When you say you had to cope with it and you had to live with it, what sort of lifestyle modifications did you have to make? What kind of things did you miss out on? How did you manage?
At the time, I didn't make a lot of modifications in my life. You just had your car, you obtained your driver's license, you're going and attending your lectures. So not much was done. Not many changes. It was later on in life that when I started understanding my triggers and the symptoms that I started implementing the changes. I just had to deal and cope with the pain as it is.
So it must have been very difficult for you to work. How was your work experience? What was your first job like with migraine?
I graduated with a BS in computer science. So my work involved sitting behind the computer screen for hours and hours. It was very difficult. And the stress of work added to that. You're a fresh graduate. Your first job, that first presentation, that first meeting, everything is stressful for you. You want to present yourself in a good image. So that stress with the work with the computers, the glare from the screen and everything were like extra triggers for migraines. Again, it was in my third year on the job that I went and saw a neurologist. So the first 2 years I also had to suffer. You cannot go to your employer and tell them like day in, day out, like, sorry, I have a headache. May I be excused? It's better for you to quit the job and sit at home. So it was difficult. My colleagues or my friends who I shared the office with understand, but like the higher management, you cannot, tell them that. So it was difficult the first 2 years on the job. The third year when I saw a neurologist and I knew like there are like some medications, some options that can be done, modifications, it's when life started to seem better. So doctor, speaking about the workplace, what advice would you give to employers to support their employees who suffer from migraine?
I think that's a very important question. We know that there are over 1 billion people who suffer from migraine, and half of those billion people do not even know that they have migraines. So migraine sufferers themselves sometimes may not realize that they have migraine headaches. So can you imagine the rest of the population not understanding that migraine is a severely debilitating disease, causing a big degree of disability? It's the second most common cause of years lived with disability, only second to low back pain. So if patients with migraine don't realize they have migraine and people around them don't realize they have migraine, that's a big obstacle. So it is normal that people at the workplace will not know that they have migraine, whether these are colleagues or managers or employers. And therefore, one of the most important things that can happen is education.
Yeah.
Educate the employees with migraine and those without migraine, and educate the managers. It's Many studies have been undertaken that have shown that when big companies have instituted such measures of simple education, lunches, webinars, educational material, that absenteeism and presenteeism reduced. Absenteeism is easily understood. It's when a patient with migraine doesn't show up. It's a missed work day. In the US, about 4.4 days on average are lost per year by migraine sufferers from work. But presenteeism is when you actually go to work, and I'm sure you've experienced this, but you're not performing as well as you should.
Yeah.
You're performing way below what you should. Your productivity is quite low. And that contributes another 10.4 days per year of lost productivity. Therefore, education is the most important thing. A migraine is not just a headache. Colleagues need to understand how severe a migraine is. 20%, 22% of people understood that if you have a severe migraine, you could miss a day from work. Whereas the other 78% of colleagues do not understand why you would need to miss a day from work. They think you're exaggerating or you're not tough enough to withstand this headache. So education is the number one thing for employers to institute at their companies for everybody. But other things are quite important as well. They need to institute changes in the workplace. We know that for many people with migraine, odors, smells can trigger migraines. So having food all around the office may not be the best thing. And therefore, there are many places in the world right now where food should not be brought into the workplace because of that issue. Lighting and sound, having quiet rooms, somewhere where you can go and rest if you need to, if you have a bad headache or a severe migraine. Yeah. So changing the lighting on computer screens, as you were saying earlier, all these things are important and will increase productivity, reduce absenteeism, and reduce presenteeism as well.
It would be amazing if they could implement those in the workplaces. Do you believe that work from home in recent years have helped sufferers of migraine?
We all passed through COVID these past couple of years, and a lot of time, most of us had to work from home. Actually, that proved to be beneficial to a big proportion of patients with migraine, because the commuting and the stress of flying all over the place and the office environment and so forth can be triggers for migraine. And by staying at home, many people actually had reduced frequency and severity of migraines, but not everybody. For some people, especially those with young children at home, those not used to being at home and being with their spouse all the time, actually that triggered their migraines. But for the majority, they did quite well. Dina, it seems like your migraines are under much better control these days.
Indeed.
How is your life different now than when it used to be before?
Well, there are many activities that I can engage in now. I have more family time, more social outings. I'm able to exercise, something that I couldn't do previously. Previously, it was like if you go to the gym, like a little bit warm atmosphere in the gym would trigger a migraine. Now it's better. I can go to the gym and exercise. I have taken my exercise outdoors. I'm able to wake up early in the morning. I wake up every day around 4 a.m., go out for a run or for a gym session, come back, start my day, be there for the kids. I mean, I don't have to stop the activities that I'm doing. The migraine is not an issue for me anymore. And on the days when I get the migraine attack, the severity is much less. And I'm still able to function and carry on my activities for the day. I don't have to drop everything and look for that dark, cool room and lie down for that migraine to reset. And this has been great for me. It's life-changing. If you look at the old me and the new me, I'm a completely different person. There's no comparison.
Dina, you recently participated in a running event. Can you tell us a little bit more about that?
I did. I actually participated into running events. I earned my first bronze medal in the first one and a gold medal in the second one.
Congratulations.
Thank you. Thank you, doctor.
Dina, you suffered from severe migraines for a long, long time, but these seem to be under control now. What changed? What happened?
That is because of the preventive treatment that I'm taking right now. I tried so many medications in the past and I suffered from a lot of side effects, but the treatment that I'm using right now just works for me. I went down from having migraines almost on daily basis. Minimum, we're talking about 25 days per month, down to 6 or 7 episodes per month. While that might be still a lot for some people, I mean, it's really acceptable for me. And when I get those like 6 or 7 attacks per month, I'm still functional. I can still carry on my activities. So the preventive treatment made a huge difference in my life. I would have not reached the level of activities that I'm doing right now if it wasn't for that treatment.
I recall initially you were quite reluctant to start this treatment that seems to have worked so well for you. Why were you reluctant?
Because every other treatment that I tried in the past, I suffered from the side effects. And in my mind, I thought this is going to be just, another treatment that I'm going to use like temporarily and I'm going to suffer from the side effects. I better not go down that road. And that is why I approached you asking for the wearables. I mean, because those will not have any side effects. They're not a medication. But I was really glad that you spoke to me about the current treatment. And I'm really happy that I took your advice because it was life-changing for me. So doctor, when do you think patients or migraine sufferers should consider preventive treatments?
I think people do not fully understand the full spectrum of migraine treatment. Lifestyle modifications is quite important, including trigger identification. Choosing the right acute therapy, the right medications at the right dose, and taking it at the right time is quite important. But for some patients with migraine, it is very important to start preventive therapy. Preventive therapy is started when people with migraine are experiencing 4 or more migraine days a month. So when patients suffer at least 4 migraine days a month, a conversation needs to begin between the patient and the doctor so as to determine whether to start preventive therapy and what type of preventive therapy. Preventive therapy can have dramatic effects on a patient's quality of life in reducing the severity of migraine, the frequency of migraine, and overall improving the quality of life. Dina, thank you very much for joining us today and sharing your story with migraine. I am Dr. Deep Kayed, and look forward to seeing you on future episodes of Mind Your Migraine.